Hello, class, and welcome to this week's lecture in interviewing techniques. My name is Dr. Neil Soggie, and I'm your instructor for this course. This week, we're going to be reminding you of something that is really central to all counseling, and that is the importance of listening. Listening over telling is our central theme for today. And it's really vital because it shifts our mindset that is from something that is pretty prevalent in new counselors, that wanting to give advice and tell, rather than what all veteran counselors know, that we should choose to listen rather than to tell. So it's natural to want to help by giving advice, but often what clients need most is someone to truly listen, to hear not just with words, but with their emotions and with the meanings that are underneath those words and those expressions. So this lecture will help you to practice some restraint and to simply ask some meaningful questions and develop a presence that speaks louder than any advice that you could possibly give. As always, I want to kind of review what we'll be doing in this class, and I want to tell you a little story about a key figure, and then we'll dive into the three themes of today's lecture that are, first off, why listening builds trust more than advice giving does. We'll then dive into some techniques for reflective listening and what we call deep listening and what that means. And then finally, we'll explore how letting silence and curiosity guide the conversation can really transform the therapeutic relationship. So those are the three themes that we'll be covering: why listening builds trust more than advice giving, techniques for reflective and deep listening, and allowing silence and curiosity to guide the conversation that we have with clients. The person I want to introduce you today is a key figure in an area of counseling and psychotherapy that I kind of consider myself a part of, and that is existential psychotherapy. Irvin Yalom is a renowned psychiatrist and author. He was born in 1931. He's a professor emeritus from Stanford University and known for his existential psychotherapy stance. And in his work, he really kind of emphasizes the power of presence, of authenticity, and the shared humanity in the therapeutic relationship. And Yalom's writing really highlights the healing that comes not from perfect answers, but from honest engagement. And he really believed that the therapist's ability to simply be with the client was often more important than what the therapist said. Presence over speech. Listening over advice. And his work reminds us that listening is not passive. It is something profoundly active within the counseling profession. Now, why listening matters more than telling? That's the question that we really need to dive into. So when we listen deeply, we are communicating respect for the other person. When we listen deeply, we are communicating curiosity and that the person is worthy of being listened to and being interested in. When we listen deeply, we communicate trust with the other person. Clients may not remember advice, but they will remember whether we truly heard them. So listening is what makes people feel seen, not fixed. And advice often ends a conversation, whereas listening deepens the conversation. So show interest, listen for feelings, signal encouragement, probe, reflect, ask open questions, clarify and summarize. Being active in your listening is key. So let's look at some basic techniques for deep listening. Deep listening involves really giving our full attention and being emotionally tuned to the person. So there are things that we can do, like first off, that I always tell my students, go slow. Even when you're excited, when something catches you, go slow. In so doing, you're allowing yourself to process, but you're allowing more the client to process and to feel the words. It's not a purely intellectual activity, counseling. It's more an emotional connection activity, because feelings and thoughts go together and feed on each other, so you can't miss either side. So pause before responding can very much be a key technique for deep listening. Pausing before responding. And just let the silence breathe. Have a pause, sit in the silence for a moment, and then respond. And when it comes to reflecting, be sure that you're reflecting the emotion. What's the emotion behind what the person is saying? Not just the content of what they're saying, but the feeling behind what they're saying, the emotion. And mirror some key phrases to show that you understand what they're saying. And always stay present, even when you feel uncomfortable. Listening well often means saying less. And that's okay. That is the way that we transform people's lives. So avoid the writing reflex. The writing reflex is the instinct to correct, to educate, or advise too quickly. And this often leads clients to resist or shut down. Instead of saying, you should, say, how do you feel about that idea? And let the client lead their own insights. We're not there to argue. We're not there to be right. We're there to facilitate the client in finding the path, because they're only going to be motivated when they are the ones at the steering wheel. No one pays attention to where you're going when you're not driving. And they are the ones in the driver's seat. It's their life. They get to make the choice. And it's our job to help them to explore and to find the motivation towards the choices that bring healing. And remember that there is power in silence. Don't be afraid of silence. Silence is a powerful tool in the counseling space. It gives you the room to think and to reflect upon the feelings that you are experiencing in this relationship, and to discover the meanings that are appearing in the client's lived world. But more importantly, it gives the clients room to think. It gives the clients room to feel. And it gives the client room to discover. And it shows that you are not rushing to fill space with solutions, that you are there honoring the client. And when you feel the urge to speak, pause. Let the client speak first, and then go from there and explore with the client what they're saying with their presence, with their words, with their emotions, with their body language, and with the meanings that are between the lines. Remember that listening really is a gift. There's a reason why we have 2 ears and 1 mouth. When we listen deeply, we are offering the client a very rare experience. How many times have you really felt that someone has listened to you? People are constantly talking at you, at school, at work. To be really listened to is a really rare event. So being fully seen without being judged is even rarer. We are offering a wonderful gift to the client. And this alone can be healing. You become a witness to their truth. You are a companion in their lived world. Listening is not a delay tactic. It's a work in itself. It is counseling. Silence and listening is one of the most powerful forms of counseling. So don't think of it as a nothing. It is using one of your greatest tools because it evokes, it draws out from the client. And so we need to think about supporting instead of giving. Rather than offering insight, ask questions that help the client find their own insight. What do you think it means for you? That might be something you ask. Or what does that bring up within you? Or where do you want to go from here? And your goal here is not to be wise. It is to make space for their wisdom, their autonomy, their choices, their motivation. Remember, listening over telling, that whole rule idea. Resist the writing reflex. Understand the patient's motivations. Listen with empathy. Empower the patient. The client might say something like, "I keep relapsing. I hate myself for this." And your response might be, you're feeling defeated. And you're also longing to do things differently. Or the client might say, "Everyone keeps telling me what to do." And your response to that might be, you want to be heard before being told. And these reflections really honor the client's autonomy and helps to open the door to deeper connections within the client's life and within that therapeutic relationship. So again, some reminder of some key terms as we close out this lecture. The first one, the writing reflex. Remember, we want to avoid using the writing reflex, which is that urge to correct or give advice too quickly. Reflective listening, remember that is responding with empathy and understanding rather than judgment. And silence in counseling, remember that is one of our greatest tools. It's not an empty space. It's a tool for allowing space for thought, for emotional processing, for making decisions. So using silence can be an extremely powerful part of your repertoire as a counselor. And what is a very common barrier to deep listening? Obviously here that would be feeling the need to fix things immediately. Remember, slow down. Slow down. And as we close out our lecture, just remember that the best counselors are not always the ones who speak the most, but the ones who listen the best. This week, try saying less. Let the people around you find their voice. And when you feel the pull to fix, breathe. Let the silence be there and reflect instead. Your quiet presence may be the loudest support that they have ever received. Silence sometimes can be a powerful ally in the therapeutic relationship. Hope you enjoyed this lecture, and my name is Dr. Neil Soggie, and I will see you next week. You take care. Goodbye.